Did you know we're living through a revolution in medicine? Treatments that were once science fiction are now saving lives. Welcome. In today's video, you'll learn about the new weapons in the fight against cancer. From innovative immunotherapies to mRNA vaccines, science is turning the impossible into reality. Cancer is one of the most challenging diseases we face, but thanks to advances in medical research, new treatment options are giving hope to millions of people. If you or someone you know is looking for new alternatives to treat cancer, this video is for you. The most common types of cancer vary according to geographic location and the specific risk factors of each population, but globally, some of the most prevalent types include 1. Breast cancer incidence. It is the most common cancer among women worldwide. Risk factors: advanced age, family history, genetic alterations, such as alterations in the BRCA1 and BRCA2 genes, obesity, hormone therapy, among others. Symptoms: lump in the breast or armpit, changes in the shape or texture of the breast, discharge from the nipple. 2. Lung cancer incidence. One of the most common and a leading cause of death from cancer, both in men and women. Risk factors: smoking, responsible for about 85% of cases, exposure to cigarette smoke, radon, asbestos and air pollution. Symptoms: persistent cough, shortness of breath, chest pain, unexplained weight loss. 3. Colorectal cancer incidence, very common, affecting both men and women, especially after the age of 50. Risk factors: advanced age, diet rich in red and processed meat, sedentary lifestyle, obesity, family history, and conditions such as Lynch syndrome and familial adenomatous polyposis, FAP. Symptoms: blood in the stool, change in bowel habits, abdominal pain, unexplained weight loss. 4. Prostate cancer incidence, the most common cancer in men. Risk factors: advanced age, especially after the age of 50, family history, ethnicity, men of African descent are at higher risk. Symptoms: difficulty urinating, weak urinary stream, blood in the urine or semen, bone pain, in advanced cases. 5. Skin cancer, non-melanoma, incidence, the most common type of cancer in the world. Risk factors: excessive sun exposure, use of tanning beds, fair skin, history of sunburn. Symptoms: spots or wounds that do not heal, raised, pearly nodules or lesions. 6. Stomach cancer incidence, more common in men and in certain regions of the world, such as Japan and Latin America. Risk factors: Helicobacter pylori infection, diet rich in salty and smoked foods, smoking, family history. Symptoms: abdominal pain, nausea, loss of appetite, weight loss, digestive bleeding. 7. Liver cancer incidence, more common in regions with a high prevalence of hepatitis B and C. Risk factors: chronic hepatitis, liver cirrhosis, alcohol abuse, obesity, diabetes. Symptoms: pain in the upper right abdomen, abdominal swelling, jaundice, yellowing of the skin and eyes, weight loss. 8. Cervical cancer, cervix, incidence, very common among women, especially in countries with less access to screening programs. Risk factors: infection with the HPV virus, human papillomavirus, multiple sexual partners, early onset of sexual activity, smoking. Symptoms: abnormal vaginal bleeding, pelvic pain, pain during sexual intercourse. 9. Non-Hodgkin lymphoma incidence, a type of cancer that affects lymphocytes, a type of immune system cell. Risk factors: weakened immune system, infection with certain viruses, such as HIV and Epstein-Barr virus, family history. Symptoms: painless swelling in the lymph nodes, fever, unexplained weight loss, fatigue. 10. Leukemia. Incidence: affects both adults and children and refers to cancer of the blood-forming tissues, such as the bone marrow. Risk factors: exposure to radiation, some types of chemotherapy, family history. Symptoms: fatigue, fever, frequent infections, bleeding or easy bruising. These are just the main types of cancer. Early diagnosis and appropriate treatment are essential to improve the chances of a cure and the quality of life of patients. Early diagnosis of cancer is essential to increase the chances of successful treatment and improve the quality of life of patients. The importance of early diagnosis can be summarized in the following points. 1. Higher cure rate. Treatment in early stages. When cancer is detected early, it is usually confined to the organ of origin, without spreading to other parts of the body. This facilitates less aggressive treatments and significantly increases the chances of a complete cure. Aggressive cancers, some types of cancer, such as pancreatic or lung cancer, are more difficult to treat when detected in advanced stages. Early detection can save lives in these cases. 2. Reduced need for aggressive treatments. When cancer is diagnosed early, treatment can be more conservative, such as localized surgery or targeted radiation therapy, without the need for chemotherapy or more invasive procedures. In many cases, this also means fewer side effects and a faster recovery. 3. Reduced costs. Less complex treatment. Treating cancer in its early stages is less expensive than treating cancer in its advanced stages, as it avoids prolonged hospitalizations, intensive treatments, and the use of more expensive medications. Fewer complications. Advanced stages of cancer often bring complications, which require additional care and increase the cost of treatment. 4. Better quality of life. Less impact on daily life. Patients diagnosed early often face simpler treatments, with fewer side effects, allowing them to maintain their normal activities and lead a more balanced life during treatment. Prevent spread. Advanced cancer can spread, metastasize, to other organs, which not only makes treatment more difficult but also significantly affects the patient's overall health. 5. Better prognosis. Higher survival rates. Several studies show that early detection improves survival rates in almost all types of cancer. For example, breast cancer diagnosed early has a 5-year survival rate of over 90%, while in advanced stages this rate can drop dramatically. Greater control over the disease. Early diagnosis also allows for more effective and regular medical follow-up, increasing the chances of successful treatment. 6. Preventing metastasis. Detecting cancer before it spreads to other organs is vital, as metastasis makes treatment much more complicated and reduces therapeutic options. In metastatic stages, the focus often shifts to controlling the disease rather than curing it. 7. Reduced mortality. Early detection reduces the death rate from cancer, as most cancers are treatable when detected in their early stages. Awareness campaigns and mass screening programs, such as mammograms and pap smears, have been shown to significantly reduce cancer deaths. 8. Detection of precancer. In some cases, early diagnosis can identify precancerous lesions, such as polyps in the bowel or abnormal cells in the cervix, which allows them to be removed or treated before they develop into cancer. This literally prevents the disease before it even starts. Therefore, early diagnosis is one of the most powerful tools in the fight against cancer, significantly improving the chances of recovery and alleviating the burden of the disease on both the patient and the health system. Advances in medicine have brought new treatment options for cancer, with more personalized, less invasive and more effective approaches. The latest treatment options include both innovations in traditional therapies and new modalities based on scientific discoveries. Here are some of the latest and most promising treatment options. 1. Immunotherapy. What it is, immunotherapy stimulates the patient's immune system to recognize and attack cancer cells. Unlike chemotherapy, which directly attacks tumor cells, immunotherapy strengthens the body's natural defenses. Promising therapies. Immune checkpoint inhibitors. Drugs such as nivolumab and pembrolizumab block proteins that inhibit the immune system from attacking cancer cells. CAR T-cell therapy. The patient's T lymphocytes are genetically modified to recognize and destroy cancer cells. It has been particularly effective against certain types of leukemia and lymphoma. Recent advances, new drugs and combinations of immunotherapies are being developed to treat a wider range of solid and hematologic cancers. 2. targeted therapies, targeted therapies. What it is, this approach uses drugs that block specific molecules that are essential for the growth and survival of cancer cells. Promising therapies. Tyrosine kinase inhibitors. These drugs block specific enzymes that promote cancer growth, as in the case of lung cancer with EGFR mutations, erlotinib, and in HER2+ breast cancer, trastuzumab. PARP inhibitors. These are used to treat cancers associated with mutations in the BRCA genes, such as breast and ovarian cancer. Recent advances. Studies are investigating new genetic mutations that can be targeted for personalized treatments, with fewer side effects than chemotherapy. 3. Gene therapy. What it is, the goal of gene therapy is to correct defective genes or introduce new, functional genes into a patient's cells to fight cancer. Recent advances. CRISPR-Cas9, this gene editing technique is being studied to modify cancer cells and potentially cure them or make them more susceptible to treatments. Insertion of anti-tumor genes. Some experimental therapies attempt to introduce genes that block tumor growth or stimulate the death of cancer cells. 4. RNA-based therapies, including mRNA. What it is, following the success of mRNA vaccines for COVID-19, this technology is being applied to cancer treatment. The idea is to use messenger RNA to instruct the body to produce proteins that stimulate an immune response against tumor cells. Recent advances. Personalized mRNA vaccines are being tested in clinical trials for cancers such as melanoma and lung cancer, with promising results in activating the immune system to attack cancer cells. 5. Stereotactic radiation therapy, SBRT. What it is, high-precision stereotactic radiation therapy uses concentrated doses of radiation to target the tumor with great precision, minimizing damage to surrounding healthy tissue. Recent advances. High-intensity radiation. The use of technologies such as CyberKnife and Gamma Knife makes it possible to treat difficult-to-reach tumors or metastases, especially in places such as the brain and spine. Combinations with immunotherapy. The combination of SBRT with immunotherapies is being investigated, as radiation can increase the immune response against cancer. 6. Next-generation hormone therapies. What it is, hormone therapies are used to treat hormone-dependent cancers, such as breast and prostate cancer. Recent advances. Newer generation drugs, such as apalutamide and enzalutamide for castration-resistant prostate cancer, offer new options for patients whose tumors no longer respond to traditional hormone therapies. 7. Nanotechnology. What it is, nanotechnology is being used to develop new drug delivery systems. Nanomaterials can be designed to deliver chemotherapy or other therapeutic agents directly to cancer cells, improving efficacy and reducing side effects. Recent advances. Clinical trials are investigating the use of nanoparticles to deliver drugs directly to tumors, with the promise of more precise and safe treatments. 8. Personalized treatments and precision medicine. What it is, precision medicine uses the individual genetic and molecular profile of each patient's tumor to create tailored treatments. Recent advances. More advanced genetic testing can now identify specific mutations, allowing oncologists to choose drugs and targeted therapies that work best for each case, such as TRK inhibitors, larotrectinib, for tumors with NTRK fusions. 9. Viral oncolytics. What it is, oncolytic viruses are designed to infect and destroy cancer cells without affecting healthy cells. These viruses can also stimulate an immune response against cancer. Recent advances. TVEC, a modified virus that attacks tumor cells, is an example of an oncolytic approved for the treatment of melanoma, and others are being investigated in clinical trials. 10. Photodynamic therapy. What it is, a photosensitizing drug is administered and then activated by light of a specific wavelength, destroying cancer cells. Recent advances. New photosensitizing agents and light technologies are being developed to treat localized cancers, such as skin and esophageal cancers. These therapies, often combined with more traditional approaches, are expanding the options available for cancer treatment, with a focus on less invasive and more targeted interventions. Advances in precision medicine and biotechnology-based therapies are especially promising for the future of oncology. So, these are some of the most promising innovations in cancer treatment that are transforming the future of medicine and bringing new hope to thousands of people. If you enjoyed the content and learned something new, don't forget to like and share this video with anyone who might also benefit from this information. And if you want to keep up with the latest news on health and well-being, subscribe to the channel and activate the bell so you don't miss our next videos. Do you have any questions or suggestions? Leave them in the comments, I'd love to hear your opinion. See you next time.